Hi everybody, welcome back. Today we're going to be talking about Accutane, or Isotretinoin as it's referred to, and lasers, or any other medical devices that are out there to treat active acne and acne scarring. Despite popular belief and all the warnings that were on the product labels of Isotretinoin, what we now know through many clinical trials and clinical studies is that Isotretinoin is not only safe to use in conjunction with lasers, but much more effective at not only clearing acne in half the time, but also preventing any signs of scarring. So this whole idea of not undergoing any treatments while you're on Accutane stems from many years ago when Accutane first came out. On the product information label, there were warnings about undergoing laser procedures because they studied full ablation lasers like the argon and the CO2 caused a delay in healing and sometimes abnormal scarring. And at the time, they were just evaluating the effects of Isotretinoin and the argon or the CO2 lasers, which are the full ablation lasers. These are very strong, powerful lasers that require a lot of healing time. With technology advancing so much, we've almost evolved past this whole idea of always using a full field ablative laser like a CO2. Although still necessary, more commonly people are now using the fractionated ablative lasers and the non-ablative lasers because it cuts the healing time and the side effects in half. In addition to lasers, we have plasma, we have microneedling with RF, we have chemical peels that are either moderate in depth or superficial to treat acne. So the treatment options today have really broadened where we don't always have to use a CO2 laser. 50 million Americans are affected by acne annually, which is a huge number. And new recent clinical trials are actually showing that certain individuals have specific biomarkers that make them genetically predisposed to scarring, whether that be the PIH, the PIE, or those indents. And a lot of us know that acne scarring, especially when they're indented in the skin, is one of the most difficult things to treat. So early prevention is pivotal. Accutane on its own can be very effective for certain individuals, and then others may need to go on a couple rounds. Lasers, chemical peels, and all energy-based devices can also be very effective on their own. However, acne is more like a volcano. You can temporarily treat the surface, but it's going to continue erupting over time. So now we're going to jump into the whole treatment recipe that we've found to work really well for our patients. I am not a doctor, I'm a medical esthetician, so I fire all the lasers and I perform all of the energy-based device treatments, but we work closely with the team of dermatologists who prescribe the Accutane, and typically the dose is 1 milligram per day for 20 weeks. While they're on Accutane, they usually come see me for anywhere from 2, sometimes 3 laser treatments, and there's really just a handful of lasers that I prefer to use that I've seen work the best. Depending on the person, if they have a little bit of redness in their skin, I'll use a vascular laser like a PDL. You guys would know of that as like a V-beam or V-beam perfecta, or BBL or IPL. And then secondly, I would use some type of non-ablative fractionated laser. And you guys would recognize that as the Moxie, the Laze MD Ultra, the Clear and Brilliant Premia, the Fraxel Dual, or the Palomar Icon 1550. So from start to finish, this is around a 5-month treatment plan. And on average, most patients are very satisfied with their results. They're clearer. Not only has their acne subsided, but their overall skin tone, the pore size, everything looks better, even cosmetically. So a lot of our patients are very happy with this. So if you're watching this video today and you're one of the 50 million Americans suffering from acne, I feel your pain. I used to be there myself. I just want you to know that even though there's a lot of opinions out there, there are some newer, not only effective, but safe treatments that are really helpful and that will help you get rid of this acne once and for all. So talk to your doctor, do your research. But I want to give you guys some hope because with all of these new recent clinical studies, they're showing that not only are lasers effective, but they're safe in conjunction with Accutane and Isotretinoin. So until next time, I'll talk to you guys soon. Bye.